Hi everyone, I'm back again, and this time I wanted to talk to you about tinea. Tinea is a fungal skin infection that is found all over the world and it's very common. There are several different types of tinea, including tinea pedis, cruris, and corporis. The main one we're going to focus on is corporis, which commonly is known as ringworm. This fungus is usually supported by humid conditions, so it can be with any economic status or gender or age, but most commonly it is found in lower income areas due to overcrowding and poor conditions. One thing about tinea that is important to note is that it can be a reoccurring infection if it's not treated properly. Usually treatment consists of some type of topical cream or solution for 1 to 2 weeks or further on, depending on the severity of the infection. Persons who have other diseases that have compromised their immune system can also be at risk for getting tinea. For instance, diabetics or people who are immunocompromised or taking some type of medication that can cause them to be immunocompromised, such as corticosteroids. One thing we will talk about is that the diagnosis for this condition is usually a clinical appearance. Sometimes it is misdiagnosed by healthcare professionals and persons themselves that have this condition, and they will use the wrong type of medication, something that might include steroids. If this does happen, it could lead to a condition known as tinea incognito, which would add further diagnostic uncertainty. So what it does is it'll alter the appearance of a normal looking tinea to where it is unable to be diagnosed properly and treated properly. So due to the array of topical solutions, the treatments that exist for this problem can be found over the counter, and you may not need a prescription for this type of medication. Some of the most common things used for this fungal infection include benzolamines and hydroxypyridones. There are also other preparations that people use, such as oil of bitter orange and eucalyptus. These forms can help the less severe cases of tinea, but if the case lingers long enough and spreads throughout the body, something more stronger is needed, and then a prescription may need to be sought after. Tinea is very common also in athletes. One form of tinea is actually known as athlete's foot. It is usually caused by the wearing of footwear that may be too snug or causes the feet to sweat without breathing through the footwear. Another case for tinea that is common is when people wear clothing that is too snug in warm climates and makes them sweat. So the proper way to manage or prevent tinea would be to wear loose-fitting clothing that breathes. Also, to keep oneself clean and try to avoid humid areas, unless of course you live in those, and then you would have to learn how to devote yourself to finding clothing that is breathable and will allow you the sweat from your body to roll off rather than be sequestered in certain parts of your body. Now that we have talked a little about tinea, I have prepared a short little PowerPoint presentation for you to see, talking more about this subject in a more scientific way. So be sure to watch the second video. Thank you.